Hello, I'm Larry Levitt, Executive Vice President at KFF, the Kaiser Family Foundation. We're headquartered in San Francisco, but I'm here in my home in Oakland, California this morning. Thanks for joining us this day before Juneteenth, the newest federal holiday as of yesterday. We certainly didn't plan to hold this briefing on a holiday, but it's hard to think of a more relevant topic on this day of reflection than racial injustice, how Asian immigrants have been affected by the pandemic and economic crisis, their fears related to immigration policy, and their experiences with racism and discrimination. We undertook this project focusing on Asian American patients at community health centers because too often this is a group of people left out of the national discussion, often invisible in data and research. Before we get to the survey and discussion of the results, we're honored to be joined by Representative Judy Chu. Representative Chu is a member of the powerful House Ways and Means Committee, where she's in the middle of many discussions of healthcare issues. And she's a longtime chair of the Congressional Asian Pacific American Caucus, where she is a leader on all of the issues we'll be discussing today. Representative Chu, thanks for joining us, and I will now turn the Zoom over to you.
Thank you so much, Larry. Yes, I'm Congressmember Judy Chu from California's 27th Congressional District. And as the chair of the Congressional Asian Pacific American Caucus, or KPAC, I'm so pleased to be here today with the Kaiser Family Foundation and all of you for this important briefing on the pandemic's impact on the Asian American Pacific Islander community. I want to thank the Kaiser Family Foundation for doing this groundbreaking research and for being such an important voice on healthcare, because it helps us better understand the needs of our communities and how we can improve our healthcare policies to meet that need. Thank you for taking this incredible initiative, which will help us shape steps forward for the AAPI community. With this report, we are going to learn more about today. One thing we do know is that even before the coronavirus hit, AAPIs have had a harder time accessing care due to language, cultural, and geographic barriers. And this is one of the reasons that the coronavirus crisis has had a devastating impact on our communities. In 2020, we saw a 35% increase in the mortality rate of Asian Americans compared to the average over the past 5 years. On top of this, Native Hawaiians and Pacific Islanders consistently experience the highest COVID-19 infection and mortality rates in several states, including my own state of California, where the case rate for Pacific Islanders was consistently over 30% higher than the statewide rate. During the initial months of the pandemic, the CDC even listed AAPIs as other on their website, which made our community invisible in the data because we were lumped in and we could not see the disproportionate impacts of COVID-19 on communities of color. On top of this, many resources about the virus and federal relief programs were not initially available in AAPI languages, even though 70% of Asian American adults are immigrants and 1/3 of AAPIs are limited English proficient. And despite pressure from AAPI leaders, 31 states did not release data on COVID-19 deaths in the Native Hawaiian and Pacific Islander population up through spring of 2021, which means that these communities are missing out on vital resources needed to save lives and contain this virus. This disparate impact has led to greater anxiety in many AAPI communities, and this has been made so much worse by the rise in anti-Asian violence that we've seen. These attacks have been happening since the beginning of the coronavirus pandemic, with over 6,600 reported incidents of anti-Asian hate in just the past year alone. They were exacerbated by President Trump, who used the terms China virus, Wuhan virus, and Kung flu, despite the fact that the CDC and World Health Organization said not to use such terms because of the stigma it will cause those of that ethnicity and from that geographic region. In fact, these attacks have become almost daily tragedies, with many wondering, will I be next? But it wasn't until the murder of 8 people at 3 separate Asian-owned spas in March that our nation finally woke up. In response, I organized a congressional delegation to Atlanta to meet with the victims' families, as well as local Asian American Pacific Islanders community leaders. And we went there with a purpose: to follow the murderer's steps to show how deliberate he was in targeting 3 Asian-owned businesses and killing 8 people, 6 of them Asian women. There's no doubt in my mind that these shootings were a hate crime. That's why I wrote a letter to the Department of Justice urging them to investigate it as such. And thank goodness, this is what prosecutors in Georgia did this spring when they said they would seek enhanced hate crime charges against the shooter. These attacks were so horrific, so obviously motivated by bigotry and hate, that they propelled the Asian American community into the national spotlight. And while we in CAPAC, our Congressional Asian Caucus, have been fighting this AAPI hate for over a year now with press conferences, statements, hearings, and legislation, it's now that we are finally making progress and our voices are being heard. Most recently, we got help from an important partner, President Biden. Within his first week in office, President Biden issued a presidential memorandum instructing the Department of Justice to work with the AAPI community in finding solutions to combating anti-Asian hate and bias. And in April, the president invited me and other AAPI members of Congress to join him in the White House to discuss additional actions he is taking. Having the meeting with the president right in the Oval Office shows just how seriously he's taking this problem. And then in May, as part of Asian Pacific American Heritage Month, 2 significant pieces of legislation passed out of Congress. First was my resolution to condemn anti-Asian bigotry and honor the lives that were tragically lost in the Georgia shootings. This resolution passed out of the House with such a strong bipartisan vote. But then the House passed Senator Mazie Hirono and Congresswoman Grace Meng's COVID-19 Hate Crimes Act with an even stronger bipartisan vote of 364 to 62. This bill helps to improve our hate crimes response by creating a new position at the U.S. Department of Justice to better track and address hate crimes and incidents. And it also includes the text of my bill, the Jabara Hire No Hate Act, which will provide resources to state and local law enforcement to address anti-Asian hate. Because it passed both houses of Congress, it was sent to President Biden's desk. And I'll never forget being at the White House at this historic moment, standing behind President Biden as he signed this bill into law. After over a year of anti-Asian prejudice and violence, it means so much to know that the voices of the AAPI community helped to create this new law to address anti-Asian hate crimes and to protect all Americans from hate. All these actions show that we are not alone in standing up to hate, but there's still much more work to do. And that is why today's conversation and the work the Kaiser Family Foundation is doing means so much. By speaking out together, we show that diversity is our strength and that America is a place where everybody can feel safe and welcome.
Thank you, Representative Chu. I know you have to leave, but we so appreciate you getting us started this morning and for your leadership on all the issues we'll be talking about today. Thanks so much.
Thank you.
So we're also pleased to be joined by Carolyn Wang Kong, the Chief Program Director at the Blue Shield of California Foundation. Carolyn is a longtime leader on these issues and a supporter of KFF, including of the survey we're presenting today. I'd like to turn it over to her to help frame the discussion going forward.
Great, thank you so much, Larry, and thank you, Congresswoman Chu, for spending some time with us today. Thank you to all of you who've joined us this morning as well. I'm really pleased to be part of this welcome crew. Happy to be on a panel with both colleagues and friends. So today's research is going to shed some new light on the conditions, aspirations, and stressors in the lives of Asian immigrants in a time of compounding struggles. There's the struggle for visibility, the struggle for healthcare access and accurate health information, struggle for economic security, and then also, of course, the ongoing struggle for safety and belonging. Asian immigrants are essential workers, they're elders, they're parents, they're children, they're human beings, and they're one of the fastest growing immigrant groups in the United States. The research that you'll hear today is really going to frame up a community-wide struggle that we've been facing for health and well-being. And too often that struggle has not had the data or the attention that's needed to drive change. At Blue Shield of California Foundation, our dual mission is to increase health equity and end domestic violence. And we know that health and well-being are influenced by many, many factors outside of the doctor's office. We know that toxic stress, financial stress, and othering can actually have detrimental impacts to health. Those are also things that drive domestic violence. And those impacts are not limited to those who directly experience them. We know that trauma and harm experienced by elders and adults can actually have lasting negative impacts to their children and grandchildren, an impact that can last generations. So we funded this research to contribute to the data that would not only support the humanity of Asian immigrants and our diversity and complexity, but also improve understanding and reset a narrative about what impacts health for these diverse communities. Racism, immigration fears, and COVID-19, all of these things have had a compounding impact to the Asian immigrant community. Racism is something that we've been dealing with for some time, and there's ongoing impacts to our health from racism that's faced every day. Immigration-related fears have actually impacted the choices that communities have made, choices that impact their health and the health of their families. And COVID-19, that's something that all of us have had to deal with over the past 15 years, the fear of how to keep our families safe. Being fearful of one of these things is tough enough. When communities face the burden of all of them, the toll is very, very significant. So as practitioners and policymakers, if we don't see and understand how those impacts impact communities, but also how they interact, then we can't address them. So Blue Shield of California Foundation is very honored to support this research, not only because it lifts up the voices of diverse Asian immigrants, those of different ethnicities, migration histories, ages, genders, and even parental status. But what's also really important is that this research could not have been done without partners in community. The Association of Asian Pacific Community Health Organizations, Asian Health Services, and Northeast Medical Services here in California, International Community Health Services out of Washington, and Hope Clinic out of Texas. Thank you all for your partnership in the research. By the end of the webinar, I hope that we as policymakers and practitioners see that it's even more clear to us that we have to continue to demand a more granular analysis of race, ethnicity, immigration status, and economic status on Asian communities in order to actually develop solutions that meaningfully address the struggle of our communities. I'm going to pass it now to Samantha Artiga, who is the Kaiser Family Foundation's Vice President and Director of Racial Equity and Health Policy Program, to share the findings. Samantha has been a champion for research on the health of immigrant communities. I've been grateful to be in partnership with her. So Samantha, I think I'm passing it to you.
Thanks so much, Carolyn. And I want to start by just thanking Larry Levitt and Drew Altman here at KFF for their leadership and support for this project, as well as Carolyn and the Blue Shield of California Foundation for helping to make it possible. I also want to thank APCHO and the health centers for their collaboration. As Carolyn mentioned, this work simply would not have been possible without them. And I want to acknowledge my KFF co-authors, Latoya Hill, Bradley Corallo, and Jennifer Tolbert. And lastly, just want to say that on this important day of reflection, I'm really pleased to have the opportunity to release new work that can hopefully contribute to our ongoing efforts to advance health equity. So if we can change over to the slide set, I'd like to begin with a short overview of the study itself. So the findings that you'll be hearing from today are based on a survey of a convenient sample of over 1,000 Asian patients at 4 community health centers, including 2 located in California, 1 in Texas, and 1 in Washington State. The respondents to the survey were largely low income, and 80% were born outside of the United States, largely reflecting the patient populations served by these health centers. The survey itself was developed by staff at KFF in collaboration with APCHO and the health centers, and it explored a number of key topics, including recent experiences with racism and discrimination, immigration-related fears, and impacts of the COVID-19 pandemic. Health center staff fielded the survey in early 2021 in multiple formats in multiple languages that reflect the patient populations that they serve. So turning to some of the key findings, as noted, one of the survey topics was recent experiences with racism and discrimination, particularly given the sharp rise in anti-Asian hate crimes amidst the COVID-19 pandemic. And what we see from the survey is that 1 in 3 Asian Health Center respondents reported feeling more discrimination since the pandemic began. Roughly 3 in 10 indicate that they have not felt any discrimination or that they have felt about the same level of discrimination, while less than 1 in 10 report less discrimination. The share reporting more discrimination since the pandemic began is higher among parents than those without children in the home and among adults who are under age 65 compared to those over age 65. Similarly, we see that California Health Center respondents are more likely to report both more and less discrimination since the start of the pandemic compared to those in other locations. Next slide, please. Asian Health Center respondents also say that they have faced a range of negative experiences due to their racial or ethnic background over the past 12 months. Over 1 in 3 report receiving poorer service than other people due to their racial or ethnic background at a store or other public place. 1 in 5 say they have been denied a job for which they were qualified. 18% report being denied housing they could afford, while others report more personal attacks based on their race ethnicity, including 16% who say they have been criticized for speaking a language other than English in public, 15% who say they have been accused of causing or spreading COVID-19 or were told they should go back to their home country, and 14% who say they were verbally or physically attacked because of their racial or ethnic background. Next slide, please. The findings also show that many respondents have ongoing immigration-related fears. Over 4 in 10 say they worry a lot or some that they or a family member could be detained or deported. These worries are higher among those who are age 65 or older, men, and those without children in the home. And among parents, we see that 3 in 10 say their children have worries or fears that they or a family member may be detained or deported. Next slide, please. The findings also suggest that these immigration-related fears are contributing to increased reluctance to access public assistance programs at a time when many are facing increased needs due to the pandemic. We see that 1/4 of respondents say that they or a member of their household decided not to apply for or stopped participating in a government program in the past year, those programs that would help pay for healthcare, food, or housing. And this is due to immigration-related fears specifically. The shares who say they did not apply for or stopped participating in a program are higher among parents and respondents in California health centers. However, parents and respondents in California health centers are also more likely to report receiving any assistance to pay for things like housing, food, or healthcare. The findings also point to ongoing information needs among Asian healthcare respondents, as over half say they do not have enough information about how recent changes to US immigration policy might affect them or their family. They also suggest that a wide range of sources may be effective for sharing information, as respondents report relying on a variety of sources for information on immigration policy. The most frequently cited sources they rely on vary or somewhat often were television and radio in their native language, followed closely by family and friends and social media. Over half report relying on newspapers in their native language, and nearly half say they rely on English television and radio, or English newspapers vary or somewhat often. Smaller shares say they turn to nonprofit organizations, the government, religious organizations, or an attorney for information related to immigration policy. The findings also show the broad impacts that the pandemic has had on Asian Health Center respondents. Over half say that they or another adult in their household lost their job or had their income or hours reduced due to the pandemic. This share rises to 75% who are parents and nearly 7 in 10 among those under age 65 or who are California Healthcare Center respondents. Respondents also report negative impacts on their ability to pay for basic needs. Next slide, please. Their mental health and their children's education and care. Nearly half say that the COVID-19 pandemic negatively affected their ability to pay for basic needs like housing, utilities, and food. 43% say it has negatively impacted their mental health, and 4 in 10 report that it has negatively affected their ability to do their job. Among parents, over half say that the pandemic has negatively affected their children's education, and 41% say it hasn't had negative impacts on their ability to care for their children. In addition, respondents point to a variety of ways in which worry or stress related to the pandemic has affected their behavior and their health. Nearly half say it has affected their sleep. 39% report changes in their appetite and eating. Smaller shares say it has led to things like frequent headaches or stomach aches, increased difficulty controlling temper, increased alcohol or drug use, and worsened chronic conditions like diabetes or high blood pressure. Overall, nearly 6 in 10 of the respondents say they have worried at some point that they were exposed to COVID or coronavirus. Nearly half report being tested at some point, with a higher share of those who ever worried about exposure saying that they have been tested. Among those who worried that they might have been exposed but did not say they were tested, the main reasons they gave for not getting tested were thinking they could isolate at home or not knowing where to get a test. Some also reported concerns about cost or being told by a health professional that they did not need to get a test. Importantly, I think the findings also show that about 1 in 10 say they had concerns about getting tested negatively impacting their ability to work, or fears that getting a test would somehow negatively affect their or a family member's immigration status, even though the federal government has clarified that getting tested will not negatively impact immigration status. Next slide. So in sum, the findings really provide new insight and understanding into the experiences of Asian immigrants, a group for whom there remains very little data and who have often been missing from the conversations about COVID-19 impacts. They document the increasing experiences with racism and discrimination amid the pandemic. They show how immigration-related fears are contributing to increased reluctance to access assistance program, just at a time when many are facing increased need. And they also illustrate the broad impacts of the pandemic, not only on people's health, but also on their well-being and finances. These findings can help shape response and recovery efforts to meet the needs of these communities, as well as further efforts to address disparities more broadly. I also think the findings in the study really underscore the importance of research and data to assess and understand the experiences of smaller population groups who often remain invisible in our public data sources. And with that, I'll close and shift everything back to Larry.
Great, thanks, Samantha. And this work is just so important and really central to KFF's mission to give voice to people, and in this case, people who are often powerless and invisible in both the data and in national debates. We'd now like to get the perspective of 3 community health leaders who worked with us in conducting the survey. Dr. Tu Quach is Chief Deputy of Administration at Asian Health Services, in fact, right here, nearby where I am in Oakland. Sunshine Monastrial is Vice President of Strategic Initiatives at International Community Health Services in King County, Washington. And Adam Carbolito is Director of Policy and Advocacy at the Association of Asian Pacific Community Health Organizations, and all of whom, as I mentioned, worked with us on this project. First, before we get to them, a reminder that you can submit questions at any time for Samantha or any of the panelists using the Q&A function at the bottom of the Zoom screen. Tu, let me start with you. Talk a little bit about whether the findings of this survey resonate with your experience on the ground in the health center.
Thank you, Larry. Again, thank you for this wonderful opportunity, and good afternoon, everyone. I just wanted to share a little bit more about Asian Health Services. We are a federally qualified health center serving 50,000 patients here in Oakland and all around Alameda County in California. And we've been around for 50 years, but this past year has been truly unprecedented. We have witnessed our patients and communities going underground for the fear of the virus, and also importantly, that they are sheltering from the dangerous and intensified anti-Asian hate. So yes, it does resonate with us. And I just wanted to share some of those thoughts. We have been experiencing the impacts firsthand, yet much of it has gone unnoticed. Asian Americans have truly been invisible during this period. This survey was born out of the need and importance of our Asian American communities to be seen and counted. And the origin of this idea came out over 2 years ago when Samantha and I first talked, and she subsequently led the charge to include Asian immigrants in the KFF survey. And we jumped at the opportunity given how long our communities have been missing in data. Thank you so much, Samantha, again, for this great work. I would say the beauty of this patient survey is that it is a breakthrough study, that these findings truly substantiate what we in the Asian community health centers have known to be true all along, that our patients have been both blamed and ignored during the pandemic, and for years and decades preceding that even. So I wanted to maybe just take the data, but maybe ground it in a patient story, for here at Asian Health Services, where a 53-year-old mother of 2 young children living in Oakland's Chinatown with her husband, in addition to experiencing the isolation that triggered past immigration experiences, marital discord, and the constant fear and anxiety about COVID-19 and the racism that she was experiencing herself, she was suddenly disenrolled from her health insurance plan. And this triggered her, all of these things triggered her, and she attempted suicide. She was hospitalized. Luckily, she was stabilized and sent home, and we took care of her. We made sure that she got the services that she needed. It's mothers like hers and thousands of patients like her that rely on the community health centers for all of these different things, not just in healthcare, but in other services. Yet I would say our health centers, we do more than care for our patients. We lift up their stories. Caring for patients like her, hearing about her fears, her experiences of racism, her mental health issues is what provided our community health center leaders who worked on this project to shape some of the key questions in the survey. We added an important question: were you criticized for wearing a mask? Not wearing a mask, but criticized for wearing a mask. And what did we find? 42% of the respondents said yes. 42% were criticized for doing the right thing. I mean, this is really powerful. And again, emphasizing some of the mental health issues that were raised. At Asian Health Services, at many of the community health centers, we've been proactively responding, setting up COVID testing, contact tracing, vaccinations. We're doing everything we can to meet patients where they are, from mobile vans to pop-up clinics, reaching kids at their schools, elders in the neighborhoods, with on-site translators, mass vaccination days when the demand was high, both in the community and in language, so that we can eliminate disparities in access. This is what it looks like to care for all Americans, immigrants, people of color, Asians, and Pacific Islanders. And make no mistake that when people are seeing these high vaccinations rates within the Asian American population, that it's because of community health centers like ours that have been working on the ground, trusted in language, in culture, in and from the community. And this is what it looks like to achieve the successful outcomes. And I would just want to say that, why do these results matter so much for us? We must be seen to be supported, that these findings underscore that the impacts of COVID-19 on the Asian American community who have been suffering in silence. The racism and discrimination has been rampant, and the chilling effects that have resulted from policies that viciously targeted immigrants, the economic loss and the mental health, and that these findings that over half of the respondents did not receive enough information suggest that there are major language access gaps for our communities. I emphasize that language access is a civil right under Title VI, and that we must understand how language barriers have impacted this population. these powerful results and the data from our health center patients can instruct us on how to respond so that our communities are not both simultaneously blamed and ignored. And I hope that they get entered into congressional documents and such, and that we'll be bringing it back to our communities in language so that we can hear their voice. And I want to say, like what Carolyn said earlier, this data and attention is needed to drive change, and that we need to work together to do it for our API communities as well as for our collective humanity. Thank you.
Thanks, Tu, for those thoughts and for the work that you do. Sunshine, let me turn to you, and it's kind of similar question. How did this survey resonate with your experience on the ground, and were there any surprises in the results?
Thank you, Larry. Thank you, Samantha, and thank you, Carolyn, for supporting this work and really trying to bring a spotlight to the communities we serve. I think for me and my teams administered this survey both within our waiting rooms for the patients that were comfortable to come in person for services, and also at our pop-up vaccination clinics earlier in the year. And I think for me and for the staff here at ICHS, the results really resonate. It's what we see and hear each and every day when we're out doing our work within our clinic walls, but also when we're out in the community providing COVID testing, COVID vaccinations, health education, dental services, behavioral health services, medical services, whatever it may be. And, just a little bit of background about us. International Community Health Services is headquartered in Seattle, Washington, but we have 11 sites throughout King County. And we provide full service medical, dental, behavioral health, vision, and senior services, in addition to a congregant meal program focused primarily on seniors. And prior to the pandemic starting, we had served 32,000 patients. And what we saw in 2020 is that we did not see 4,000 or 15% of the patients we served in 2019 return for a visit in 2020. And I think that underscores the fear and discomfort people had during the height of the pandemic of being exposed to the virus itself, and the stressors in terms of perhaps losing their job, the financial impact, the loss of insurance coverage, the multiple factors that have contributed to sort of changing their behavior in terms of seeking the care they needed. And for me, I think the results of this survey really sort of busts open that myth of the model minority, that Asians are wealthy, well-educated, because we know in the work we do, given that the vast majority of the 32,000 patients we serve are Asians, Asian Americans, and Pacific Islanders, and 3/4 are low income, over half are impoverished. And 60% require services in a language other than English. So the fact that, the language and cultural competency of the services we provide is really critically important, not just for us, but for service providers throughout the nation, where there are large numbers of Asian immigrants and other immigrants in the areas that they serve. And, I think Tu so beautifully sort of did an overview of the very many different factors that the survey covered. And for me, re-reviewing the results, it was refreshing to see how vast and broad the many different impacts and challenges, despite the results being very difficult to see, of all of these different factors that have sort of culminated over the last year and a half that have impacted our patients. There's a racism that has been exacerbated by the pandemic. Obviously, it existed even before then, but really with the Trump administration, it got even worse. The chilling effects of the immigration policies of the previous federal administration continues to resonate and have impact within the patients we serve. And that data point that Samantha highlighted regarding the confusion regarding the current policy around immigration, even for those who are legally present here and what services they are eligible to access, is really critically important, because clearly, given the different sources that people rely on to get that information, it is really the in-language TV, radio, newspaper, and media that's really required. And it's not simply that the federal government has changed the rules, that we need to have a proactive sort of communication campaign to really educate the communities that are impacted by these rules and let them know it is safe you can access these services that you have been legally eligible to access. The other thing I wanted to sort of underscore that too already touched upon is the mental health impacts. Obviously, beyond the financial stressors that we've all experienced during this pandemic, the patients we serve not only have, many of whom are small business owners and low income folks, that the financial stress on top of the discrimination, increased discrimination they're facing as a result of this pandemic. And then those two things on top of just not being able to access the care they needed during the pandemic, I think has really compounded. And now we're really seeing sort of a critical point in the mental health issues facing the Asian community. And I think it really underscores the importance of offering and providing in-language mental health and behavioral health services by providers that look like and can relate to the patients we're serving. I think that's critically important. I think those are the two main points, is that, the model minority is a myth. And the fact that now where we're at today, mental health is a significant burden faced by many in our communities. And, it's an issue that has been stigmatized, and we really need to do our part to promote that these services are available, and that what we can do to address the many fears, isolation, and anxiety that our communities are facing, coming out in sort of the slow recovery we're making from this pandemic. Thank you, Larry.
Oh, thanks, Sunshine. And a lot of issues I want to make sure I come back to, but I do want to bring Adam into this with a somewhat of a federal policy perspective. Thinking about these survey results, what policy levers do you think are available to address some of these issues? And how has the environment changed, with the change in administration from President Trump to President Biden?
Yeah, absolutely. And thank you, Larry. And I do first want to add also my appreciation to Samantha and the KFF team for all your work on this survey, and Carolyn for your support of this work. It's a pleasure to be with everyone here today alongside Congresswoman Judy Chu, who has been an extraordinary champion in Congress for Asian Americans, as well as Native Hawaiians and Pacific Islanders, as well as my colleagues, Dr. Tu Quach from Asian Health Services and Sunshine Manastro from International Community Health Services. For everyone on the call, as Larry mentioned, I'm Adam Carbolito with the Association of Asian Pacific Community Health Organizations. For those who are unfamiliar with us, APCHO is a national association of community health organizations, including 27 federally qualified health centers that advocate to improve health access and outcomes for medically underserved Asian Americans, Native Hawaiians, and Pacific Islanders, and the community health providers that serve their needs. We're proud to collaborate with KFF and our member community health centers on this survey to better understand and demonstrate the deep-seated challenges affecting Asian American patients. And I think Tu and Sunshine really have outlined it beautifully. And Larry, in response to your question about what can be done from a federal perspective, first is data from this KFF survey really underscores what we have long known. Asian American communities face threats to their health and well-being. Asian Americans are disproportionately impacted by COVID-19, and the pandemic has exacerbated health disparities in our communities. And rises in anti-Asian racism and anti-immigrant rhetoric and policies, like the public charge rule during the Trump era, which thankfully President Biden has rescinded, make it more difficult and more confusing for our communities to get the care they need, and trust that doing so will not put them or their families at risk. This study is a segment of our communities, underserved members who have access to or receive care at federally qualified health centers. And I hope it's a starting point for future understanding and better data on Asian American communities. There continues to be a lack of accurate, consistent, and reliable data for our communities. And unfortunately, the Asian American experience is often overlooked, or data is not disaggregated and reported in a way that is meaningful to our vastly diverse populations. Asian American communities are incredibly diverse. We comprise about 50 ethnicities, speaking over 100 different languages, and each of our communities experience healthcare and the challenges to their health differently. And we need disaggregated data so we can better understand these health disparities and ensure that we are targeting interventions in a way that are most meaningful to patients. And I also want to highlight that language barriers, as both Chu and Sunshine and the survey underscores, pose an important and significant challenge for our community members. We're fortunate that at many APCHO member federally qualified health centers, our members are able to provide care and help patients navigate the healthcare system in a language they can understand. And I'm sure Chu and Sunshine will be happy to speak more about how that makes a world of difference to their patients. But adequate language access services are not always available. And COVID-19 really has shed light to how dangerous and widespread language access challenges are. It's imperative that individuals are communicated with in a language they can understand. And there needs to be more availability of qualified interpreters, multilingual staff, and translated materials at every stage of the patient experience. And we need more support, more funding from the federal government to help FQHCs and other community-based organizations provide the language access services and conduct and collect better data on Asian American communities so that we can meet the challenges that our patients experience. So I really do hope that policymakers will use this report to better understand some of the challenges our communities face and really the multiple pandemic that Asian Americans are facing at this moment in time. Rises in anti-Asian racism, fears from immigration-related policies and confusion on what these policies mean to them and their families, and the health and mental health challenges that COVID-19 has had on every member of our community. So really thank you and to our KFF partners for uplifting this important work. And I hope that we will continue to have these conversations so that we can prove the health and well-being of Asian Americans, as well as our Native Hawaiian and Pacific Islander communities, and help move the needle so that every person in the United States, but every person, regardless of their immigration status or spoken language, can really receive the care that they need. And we hope that Congress and this administration do more and are faithful partners to securing better health outcomes for our communities. Thank you.
Thanks, Adam. I mean, you all mentioned prominently mental health issues. Access to mental health care was certainly an issue before the pandemic. The pandemic exacerbated the stress on families, as Chu talked about with that one patient, and racism as well. Creates stress and mental health challenges. So what? What are some of these solutions here? Is it money? Is it more providers? What could be done to increase access to mental health in these communities?
I can start on that. It's interesting that the pandemic brought so much suffering and challenges in our community. But interesting enough, it also brought opportunities of telehealth. And I think a lot across all of our health centers, because of the transition to telehealth, patients started using the mental health services more. There's always been a lot of stigma in the use of mental health among our patients. Sunshine and I share that, and we know it happens among many of our other patients across different health centers. But switching over so that they can make a phone call or be able to see someone without coming in made a big difference. And so I know at our health center, the requests and the demand for mental health, it skyrocketed. We were, overbooked, and it was important. And even when our staff were just calling to check in with patients, they were in tears because they went underground during this period. And I think as we get into a recovery stage, the mental health will continue and actually escalate. That during this period, the anti-Asian hate, the fear of COVID, the economic loss, really put people over the top. But these are immigrants, and in many cases, it re-traumatized them, to be locked up, feeling locked up, and feeling like they isolated and had no place to go. I mean, all of these things were what we heard from our patients. But it's important to invest in places like community health centers where we have the bilingual. I mean, language access cuts across all of this. And so I want to emphasize it's not just needing more providers, but needing bilingual and culturally competent providers that are grown from the communities and understand it, not just basic language translation and interpretation, but really from the communities themselves and are understand the cultural nuances and the impacts. And so I think that as we look across the nation and see the demand in mental health, we also have to consider the cultural and linguistic needs.
And to add on to that, Larry, I think, too, I think you're exactly right. The other things I would add are that pipeline that Tu touched upon is really important, and really recruiting and cultivating folks from the communities to become mental health providers or behavioral health providers so that they could be serving their community members. And one thing we know, we have a Health Career Connections program at one of our school-based health centers. And the biggest challenge from introducing these recently arrived immigrant students at the school to different healthcare careers beyond just being a doctor is that the financial means to pursue the education that they're interested in pursuing to become whatever health career profession they'd like to do is a gap. And so I think really providing the scholarships or financial support to these students who have the interest in pursuing these healthcare careers is really critically important. And I think the other thing I would add is, beyond telehealth, really thinking innovatively about the different models of care we can provide as community health centers and as other service providers, is that really looking at as it becomes more safe, the financial support for group visits, peer support networks, and things like that is critically important, because what we've been hearing most recently with the rise in anti-Asian discrimination and hate and harassment among not just our patients, but also our staff, is that people are feeling depressed, anxious, lonely, and some of the usual sort of tools to try to address those conditions is to go outside and take a walk, which is not really as safe as it used to be being Asian. So I think, trying to build a network and connect our patients so that they can not only support each other, but then we can also convene and facilitate the kind of services where they can feel a little bit less alone, a little less anxious, and feel more connected within their community, I think is really important. And the funding mechanisms to support these innovative care models would be really important for us to be able to do so sustainably.
Yeah, and I'll just say, Tu and Sunshine covered it all. It's a yes and approach to all of this. I think there are many tools that are available, but really providing the investments and the funding support to federally qualified health centers and community-based organizations that are really rooted in the community and that are trusted by community members so that they can have these honest conversations and they can help to destigmatize mental health challenges and being able to reach out when they do need help. So I hope that, that Congress, the administration, government, foundations do really invest in CBOs and FQHCs so that they can do the work that they have been doing for many years and have the built-in trust and networks within their communities to outreach and improve so that they can help their patients and their community members improve on the mental health challenges that they're experiencing. So all of the above.
Thanks. I mean, the other issue you all touched on was language and cultural diversity in the Asian and Pacific Islander community. And we had a question from the audience about whether we found any differences among different linguistic groups in the survey. Samantha, you want to talk about that?
So as I mentioned, I think one of the real strengths of this survey in particular was the diversity of people that were included in it. Still, even with the diversity and with us completing the survey in multiple languages, there are limitations in how much we're able to say and which groups we can make comparisons for. We were able to make some comparisons between Chinese and Vietnamese respondents, which are included in the survey report and is documented and is available on our website as a published brief now. So you can go through the report there and find some of those experiences. But I think again, we need still even more data to dig into the diversity of experiences. And as Adam pointed out, you know, they're just such a rich set of different experiences and language spoken among the community. And so we've attempted to capture some of that here, but more work remains, I think, to really begin to understand the variation of experiences within the community overall.
And Samantha, let me stick with you. I mean, one of, I think as this discussion shows, one of the real kind of path-breaking elements of this research, first of all, the focus on a community that is often invisible, but also pairing, you know, the research expertise at KFF with the expertise and community connections of the health centers. What are more things that we could do, that health centers could do, that we could do together to kind of move this work forward?
Well, I mean, Tu and I were connecting at the beginning of this panel. This survey report, this project is really the realization of a goal that has been in place for many years, that really arose from a conversation Tu and I had about wanting to do a better job of integrating and giving voice to Asian Americans within our research at KFF. And certainly the survey itself has some limitations, as I just noted in my previous comment, but I think the lesson from this project is that we cannot let the perfect be the enemy of the good. And that for too long, research does not focus on these populations, does not disaggregate the data because it is challenging, because it requires resources, but we cannot let that stand in the way of obtaining information to better understand the varied experiences of people, providing the data to help shape efforts to respond to people's needs and advance efforts for equity going forward. And I think the other lesson from this is the importance of engaging community in this research. We could not have done this research without APCHO and the community health centers. They were integral not only in terms of fielding the survey, but also in terms of developing the survey, understanding what the information needs are, how the information can be helpful going forward for meeting their patients' needs in the future. So I think there are a lot of important lessons here about continuing to further work, even amidst challenges and limitations, the importance of still giving voice to these populations who continue to remain invisible in our federal data sets often. We've seen it in the state reporting of data related to COVID-19. As was mentioned, in many cases, Asian populations are grouped in and lumped in into other categories, which don't allow us to understand their experiences. The disaggregation of the data is key for dismantling the model minority myth, as Sunshine pointed out. So, you know, I think it's on all of us as healthcare researchers to continue to advance this work, to think about how to engage community, to not only further this work, but to also then benefit the communities that are participating in the research. And I think it also points to the continuing importance of government expanding the data available through federal data sets, state data sets, given the continuing lack of disaggregation in the data.
Thanks. I want to return to immigration policy for a moment. You know, certainly the Trump administration had an agenda in opposition to immigration and immigrants. The pandemic, particularly in the Asian American immigrant community, exacerbated that. Given the blame surrounding the origins of the virus. we have seen a different direction from the Trump administration, from the Biden administration to some extent, but as the survey shows, there's still confusion about immigration rules, and you all talked about some of that confusion. Kind of what, how do you see that changing now? How do you see, what do you think can be done more to help educate people about their rights, their immigration rights? You know, what could we be doing better at the community level to help protect people and help them understand their rights?
Well, I can go ahead and start. First, I think that there definitely has been a change in tone within the Biden administration that has been welcome and helpful to advocates, to our communities, to really change, you know, that change in tone to make them feel, immigrant communities feel more welcome within the country, and decrease some of the fear that they may have. But there's still a lot of fear and confusion, and it'll take a long time to overcome some of that fear because of the many years of anti-immigrant rhetoric and policies of the Trump administration, but also anti-immigrant policies that have been in place for many years before the Trump era. You know, going back to welfare reform and the PRR restrictions back in 1996. And so, what I think would be helpful in an immediate point is for, you know, the Biden administration to issue more guidance and clearer guidance on the impacts of immigration-related rules and some of the actions that they have taken or will be taken to make immigration policies more welcoming to immigrant communities. I think that needs to be done at a federal level with government logos, with government action, so that there's a level of authority when our community members, when our advocacy partners go out and talk to individuals, that there's that level of authority that they have, because the federal government has issued this under their seal. I mean, I think there's just a lot of credibility that comes with that. Secondly, I think that we need to work towards removing some of the long-standing immigration barriers that have been in place since 1996. I mean, you know, PRR made it so that immigrant communities could not access many benefits programs within the that are provided to other members of our community. Many immigrant communities can access Medicaid, can access SNAP, can access other benefits programs. And if they do become eligible because they become permanent, lawful permanent residents, there's a 5-year waiting period for them to be able to access that. And we need to start breaking down those barriers, because when they can't access these programs, it does jeopardize, and it does make it harder for them to achieve good health outcomes. And that just makes all of our communities less safe, and it impacts the health and well-being of every member of our community, not just the immigrants that are impacted of it by those policies. So I think that COVID-19 has really made some of that more clear. We've been happy to see some of the actions that the Biden administration has taken. We hope that both the president and Congress will do more to uplift immigrant communities. And you know, I think we're all ready to work with them in that lens.
And the one thing, if I may, just to add to what Adam said, I think what we've heard from our patients and communities is that they do like to get information that's formally from the government. Otherwise, they don't believe it's true. But I think, you know, the importance of language and trusted partners within the community, that the federal government then needs to partner with community-based organizations, including community health centers across the nation, to help be the messengers for those formal decisions and policies, so that we can ensure that we're blanketing our communities with that information. Because if it only comes from the government itself, it's not so accessible. It might not be in a language they understand. So I think that communication campaign and outreach is a critical component that the federal government should consider as part of you know, doing away with the misinformation and really getting the truth out there to our communities.
And I would just add, we knew as soon as the public charge policy change was introduced that the chilling effects will come. And we are now trying to do damage control, and it's going to take time and resources. But it really speaks to prevention. I mean, we're all public health in this arena, and we know prevention really is key. And, for us, we form One Nation, Asian Health Services and APCHO and ICHS and many others, 100 organizations. We were fighting it because we knew that to have to deal with the chilling effects will be hard. And unfortunately, it was like this perfect storm. Public charge took effect, and then weeks after, COVID happened, and now we are having to do damage control, and that is always hard, and it's going to take time. And it really speaks to how we need to draw on the power of our community to not have these types of policies happen again. And I think that's about building power within our communities.
Thanks. Well, we're unfortunately at the top of the hour. I think we could go on for many hours, and certainly we at KFF will be returning to these issues many times in the future. And I think what this discussion, particularly this last discussion, illustrated is that you can't wall off healthcare. Healthcare is so dependent on so many other issues, whether it's racism, whether it's immigration policy, and other stressors in people's lives. And organizations like yours, community health centers, also don't just address healthcare needs in their communities. It's a much broader role that you all are serving. So thank you for all you do. Thank you for this work with us, and thanks for this incredible discussion. And thanks again to the audience, again, for joining us on this important holiday.